see a countdown, but I see your name, and Happy New Year.
All right. Hey, everybody. This is Mike Ward, and I am with a very good friend of mine, Dr. David Foley. And this is our first episode of the new year. David, how you doing?
I'm doing great. It feels good to be in a new year, fresh start.
Yeah, man, I'm excited. Do you have any New Year's resolutions that you made?
I think that since I've sort of already tackled one of them, which is some weight loss this past fall, I'm going to focus on being less reactive to situations and more active in my approach. Someone told me a long time ago when I was 21 years old, stop reacting and start acting. And I think that's probably the best advice. And I think at age 52, I'm finally ready to listen. I'm going to stop being reactive and being more active.
I like that, man. I like that. So, that's hard, though. It's hard to to not react. Yeah. When let's just say that somebody says something, and I don't know if this is exactly what you mean, but somebody says something to ruffle your feathers. Our first instinct is, our first emotion is pain, is hurt, right? But sometimes we skip right through that really fast. And then anger manifests as pain, right? Sure. And then we snap it. I'm guilty, bro. I've done that, and it doesn't feel good.
Yeah.
Is that what you mean?
I do, and I'll tell you. I was telling some students right before Christmas, the Christmas break. Eustress is something that should be really positive in our lives. Going back to school, which is I'm taking a class this semester, getting ready to spend holidays with our families, that's wonderful eustress. Just like eupnea, ideal respirations, eustress should be a great stress. Unfortunately, it becomes distress very quickly if we let it get out of hand. And we need to be, I need to be more organized so that I can be more active. And I think that's part of my personal definition of being active is staying on top of things more before they get out of hand so that eustress doesn't quickly become distress.
I like that.
Yeah.
I like that a lot.
Sure.
So, everybody, for all our viewers out there, we want, obviously there's, this is, our first podcast of the new year. It's New Year's Day. A lot of people are probably just recovering still from a great party last night.
Right.
So, we're going to wait a couple seconds as people start filing on. But what I want to do is first, I want to announce that this broadcast is brought to you guys by Merce World Scrubs. Okay. And so we have a special deal for all the viewers in AAMN who want to take advantage. You go to merceworld.com and you can get 15% off any scrub purchase. And they're a scrub company that they specialize in scrubs for men only. Mm-hmm. So I will put the link down below, and the discount code is AAMN15. And I will also put that down below too. And, so get you a good set of scrubs for the new year, go to work feeling good, looking good. Also, I would like to kind of read Dr. Foley's bio here. This guy is so impressive. We met face to face at this last conference, and man, I love just the quality people that you get to meet when you're a part of this great organization. It is what you make of it, just like anything else, though, right? I mean, if you can get involved, you can become a member, but you can choose not to do anything and not get anything at all out of this, right? Or you can take advantage, network with other people who are doing, some great things in the profession, go to some of the conferences, attend some of the chapter meetings, and really, really get to network and socialize with just amazing people like Dr. Foley here. So, wow. I really, really appreciate your friendship, man. And I really appreciate you taking the time to have a little dialogue with me. You got some great stuff we're going to be talking about tonight, and I'm really excited to hear about it. Let me tell you guys, let me introduce you to Dr. David Foley. He's an assistant professor at Case Western Reserve University's Francis Payne Bolton School of Nursing. A Cleveland, Ohio native, he has previously served as local communities program manager and residential facility for dually diagnosed individuals with mental illness and mental retardation or developmental disabilities. Director of Operations for Women's and Children's Services at Metro Health Medical Center, and nurse manager and administrative officer for the local VA Medical Center. He's dude, you've just done all kinds of stuff, and now you're going back to college.
Yeah.
I mean, how do you have room for all this stuff up there?
Well, I'll tell you, it's sometimes I wonder who that is you're speaking about. You know, when you go through something, you just don't realize what you've gone through, and then at the end, you look back and you say, "How did I do that?" I think it goes back to I just submitted a book for publication. It's in New York in the hands of editors. I'm fingers crossed. I'm biting my nails this whole Christmas break. But one thing I talked about is when I went back to nursing school, I it was a second career for me, and I was happily the director of operations at that hospital. And one day I was so inspired by some of the comments some of the nurses made in the meeting. I said, I've got to go and check out this world of nursing. And I did it. And I went back just on a whim. I'll go to nursing school now. And I did it in the evening and weekend program as an evening weekend warrior. I would leave the hospital in a suit, and many times I changed clothes in the car. Can you believe that? Maybe you can. And pulled behind a dumpster at Burger King sometimes, and just I could never do that again. Thank God that was 25 years ago, because I would not be able to do that again. So,
I
but
can't imagine, man.
yes, I feel very grateful. God has been good to me, and helped me accomplish a lot, and I'm very grateful. So thank you for that kind word.
Oh yeah, absolutely, man,
Yes.
absolutely. So tonight you are going to be able to discuss with us, with everybody, engaging in self care in the new year.
Mm,
That's a big topic, man. That's huge. That's
sure is.
as nurses, as you and I were talking before, and we take care of everybody else. I mean, and we neglect ourselves in a big
Sure.
way. So I'm
Absolutely.
eager to hear, your words of wisdom on this topic.
Sure. So I think that for me, the first thing that comes to mind is as nurses, we have very high expectations for ourselves. Sometimes I think we have high expectations for others. But just in general, we expect a lot. And because of that, sometimes I think we go headlong into change. At this time of the new year, we're going to make New Year's resolutions. One of the reasons why so many of those fail is because I think we do expect too much. Typically, New Year's resolutions like getting healthy and getting involved in physical exercise. Someone might go to the gym, and they might go to the gym and say, I'm going to go for an hour a day, 5 days a week. It's too much. It's not sustainable. And it takes me right back to in nursing school, if you remember the concept of what a SMART goal is. SMART goals are specific, measurable. So going to work, going to the gym for an hour, 5 days a week, that sounds, fairly specific and measurable. But it's the A and the R that trip people up a lot. And that is, are they attainable and are they realistic? And of course, the T is for a time frame component. So that's the 5 days a week. So for someone like me, going to the gym 5 days a week is not a SMART goal because I would associate that with pain and suffering very quickly. It's not something that I would enjoy. But if I would say that I'm going to go out and engage in a vigorous walk 3 days a week for a half hour at a time period, that's something that I could fit into my schedule. It's something that I would be able to do. It's something that I would enjoy. So I think that, again, when we look at engaging in self-care for the new year, try to do things that appeal to you. Try to do things that are smart, that are just embedded within a SMART goal. And I think that's a huge part of the success. What do you think?
Yeah. So, having smart goals. I don't know when the last time I've actually, it's probably been a couple of years, but I mean, I used to engage in a business where, I kind of tried to drive that into people's minds. Smart goals, smart goals. They got to be specific, measurable, attainable, that kind of stuff. All important because you can't just just say, I'm going to lose weight or I'm going to, treat myself better. Just first of all, you got to write them down. I mean, I feel like just writing something down. There was actually a study, and I wish I had that information on me now. I wish we knew. I wish I knew that we were going to talk about this specific thing because I had some good information on this. But there was a study, and it was shown that people who wrote down their goals were like, I don't know, they made 70% more money than people who just stated their goals. And they had just so much more success than people who just stated their goals. And just the fact that you just write it down and put it where you can see it and then be specific and all those things. It's so important. But, I mean, it's just as easy to do it. It's just as easy not to do it, which is
Sure.
why most people don't.
Yeah, exactly. And I think before you even start to look at making some positive changes for self-care. There's a couple concepts that, my clinical specialty is psychiatric mental health nursing, and that fits in, I think, pretty well with the concept of self-care, because that's what I really try to work with students on and work with faculty on in my new position as faculty development director for Case Western. But you look at, what is your own sense of belief in yourself that you can even create a change or engage in self-care? It's a concept called self-efficacy. That's a person's perceived belief that they can make positive change in their life. So maybe somebody might say, I've had people tell me, I would love to eat healthier, I just don't know where to start. So because you don't know where to start, that belief that you can create a positive change for eating healthier just isn't there. So before you even decide to really take better care of yourself in the new year, it's probably a good idea, and I love the idea that you brought up about writing things down. Sit down and write yourself a little letter to yourself and say, I believe that my perceived ability to take better care of myself is defined as what? And I think you'll find that there might be some pre-work that you're going to have to do. Maybe you're going to have to resolve some issues, unresolved issues in a relationship, unresolved issues in terms of grief that you might have had or suffered a loss this past year. There might be something that you need to resolve before you can move forward. Sometimes we get stuck, and part of moving forward and taking better care of ourselves is just getting unstuck.
So just a little self-reflection, and kind of figuring
Absolutely.
out. It's funny that there's so many times I feel, I've looked back and I've had stumbling, things that's caused me to stumble, some stumbling blocks. And I have, if you get to the root of the problem, it's always something that maybe, at least for me, in a number of occasions, it's been something that I've just had this mental rut, this something that I have, like maybe I had experienced that led me to believe, or maybe a perceived notion that was not exactly real, but it's something that I built up in my head,
Sure. Yeah.
and it was just causing me to, to get tripped up, and so I kind of, I feel you on this. I totally feel you. So much truth in that.
So as we talk to sometimes about clients or our patients, where is your locus of control? Where is your center of control right now? If your center of control is externalized and you're allowing situations and outside people to control you, you're not really going to have a high sense of self-efficacy or ability to move forward with making change. But if you can resolve some of those issues and relationships and bring that locus of control closer and closer and hopefully internalize it, it's a real feeling of empowerment that, yes, I can do this. And I know that for myself, I've recently celebrating some weight loss, which is what I really needed to do for myself for the new year. I think back over my time as a nurse, and let's just talk about being a staff nurse right now, because we have a lot of staff nurses in the organization. I can remember as a new graduate, people coming up to me and saying, can you watch my patients for 10 minutes? I'm going to run downstairs, grab something in the cafeteria or the vending machine, come back up, eat real fast, and I'll be back in 15 minutes. And first of all, what kind of food are you going to be able to inhale in 15 minutes? It's not going to be something healthy. How many nurses out there do you know do that? And it adds up over time. It really has an effect on one's health over time. So I told the young lady one time, I went back to nursing school when I was in my late 20s. So I was always a little bit older than the people in the class. So by the time I graduated and I heard her say this to me, I said, no, you're not going to do that. And she said, what do you mean? I think she thought I was going to tell her, you're not leaving. You can't have a lunch break.
That's what you. That's exactly
I
what you
said, no. I said, no, you're going to walk slowly to the cafeteria, and I want you to get some food and take your full half-hour lunch break. Enjoy, nourish yourself, and then when you come back, I'd like you to do the same thing for me. You watch my patients while I have the chance to get off the floor. As we know, we don't always get a chance. We're there to serve patients. If they're not well or they're sick, we have to take care of them. But at the same time, I think it's important that when you do have the chance, please take your breaks. Please nourish yourselves. It takes a lot of work, I know, to eat healthier. I've found out that it takes a lot more planning. It takes more trips to the grocery store. It's a lot easier to eat a burger on the run than it is to get up in the morning and chop a salad and make a healthy salad and take it to work. But why would we expect it? We would tell our patients to do those things. Take care of yourself, eat
That's true.
healthier.
That's
But we're
true.
not willing to do those things for ourselves. And why is that? I wish
Well,
I could.
I have an idea of why we might not be able to do that. Every time I'm on shift, man, there's donuts in the break room. Patients, their families bring cookies or something, and if we're in a hurry, are we really going to take the time, and this again, a lot of people. So I work in the emergency room, and many times it's very, very busy, very, very busy. And, a lunch break. I mean, I've skipped a few lunch breaks in my time, and it's not because, I did not want to skip a lunch break, but there really is no time. And if you don't, like you said, if you don't plan ahead and bring some healthy stuff to snack on, you're going to reach for that junk that's just so easily accessible right there on the table, or in the break room, wherever it's at. And so it definitely takes planning. But, lately, we get a lot of this, take your break. You have to take your break. You have to take your 30-minute break, and they're starting to actually, you're getting penalized if you don't take your 30-minute break. But people still choose not to. And I think if it's that big a deal to management, it certainly should be a big deal to you, and you should definitely take the time. Figure it out. We're all a team. Teamwork makes a dream work.
Absolutely. So what I did, one thing, and not everybody has an office, but hopefully everybody has a locker. Once a week, I bring in like 2 grocery bags of healthy food, small grocery bags. I stock my office. I have Tupperware containers of healthy nuts. I bring in, low-fat, non-flavored Greek yogurt, which is high in protein, things like that. And I stock up the refrigerator, and then I don't have to worry about packing lunch for 2 or 3 days. So tip to pass along, try to bring in good things. But let me ask you a question. Why is it, do you think, that some people are reluctant to take their half-hour break? You mentioned that. Why do you think that is? What's the artifact there?
Yeah, that's a good question. Because if they're making us take the break, and they're, usually it's a charge nurse that comes around and says, okay, you need to take your break. Get with somebody, whoever else is in your pod, let them know you got to go take your break, or, come and tell me whenever you're ready, if you're wrapping something up, and then I'll make sure that somebody covers you. I don't know if it's like that everywhere, but I know that most places that I've worked are like that now. So I don't know. Maybe it's people just don't want to. And I'm only speaking from the emergency department. When I work in the ICU, it's pretty easy to take a break. Most shifts, but in the ER, which I work mostly, I don't know, man. It seems like there's always loose ends, and I just feel like a lot of people don't want to. They don't want. Listen, let me just wrap this up. I just need to knock this out real quick, and then by the time they get it finished, it's like 4:00. It's almost time. 3 hours before it's time to go, right? Yeah. And so I don't know. Maybe it's that. I don't know.
I think that when this goes back a long time, but they used to say that nurses eat their young. And part of me, I wonder, and I hope it's not this, but I've seen this a lot in my life. People, especially the younger nurses, are afraid to go to lunch because they're wondering, are people going to pick through their work? Are people going to look over and say, why didn't you do this? Why didn't you do this? And really they're going to have a very critical colleague waiting for them when they get back. So the temptation is, I won't leave. I'll just stay there so I can continue to manage everything. And, I really think that if there's any of that going on, that we all need to be vanguards and really make sure that we tell people, because, you don't know how that nurse's day is gone. You don't know what they're prioritizing. And if they're not there, we all need to really make sure that we get everybody off to break. So I think we could try to resolve to do that for the new year. And I really respect the fact that charge nurses are going around trying to get people off on their breaks. I think that's a good thing.
Yeah, definitely.
Definitely, sure. So I also think that I was talking about the challenge, which I'm really uplifted by the new health challenge that you're bringing up here, the 10 for Men, I believe it's called, and I think that's really great. I just want to encourage everyone, such as myself, just to remember that we have a lot of diversity of different levels of physical fitness in the organization. And remember to set those SMART goals, because if you I know for myself, I can't get in there, and I can't get in there with the younger guys who can do the treadmill much longer than I can, but I can do what I can do. And to really be
Hey,
very realistic and set those expectations, just because moving forward is better than standing still at all costs. And just really, be good to yourself and set realistic goals.
I like that. And I always have said this: even small progress is progress. Because most people. Another saying is, you're out lapping everybody is sitting on a couch, which most people are, right?
Yeah.
And I feel like there's so many people that will give it a go, or at least give something a go. Unfortunately, that enthusiasm, when it wears down, so does their motivation to adhere to, whatever it is that they set, in their mind that they wanted to do or accomplish. So my advice would be to steer, continue to press forward, because you're going to come in. I mean, once the excitement wears off, you're going to want to stop, and that's just human nature, man. People are just like that. And I would just encourage each of you who are listening to this, if you set a goal or a resolution, push through. Just know that the person who wins is the person who stays on,
Sure.
stays on the longest. The last man standing is the winner, right?
Yeah.
And that's with everything. Consistency, just staying even whenever the excitement is worn off. Just remember, like you said, the SMART goals. Put something up, to remind you this is what I'm doing every day. It's easy to forget when you're in a hurry, or, when you're not thinking about it. I'm starving, I need to grab something real quick, but then, and I've done that, and I've looked back and go, well, why did I eat that? I am trying to lose weight, and I try to, I got to circle back around, like, come on, man, you're going to refocus.
Sure. Absolutely.
So,
and I think that the concept of what we call, a friend of mine confided in me, who happens to be a nurse, that he was just recently diagnosed with type 2 diabetes, a hemoglobin A1C of like 10 when they found it, and said, I'm really scared. And he said, it's time for a radical change. And so the difference between that transformational change, when you have no choice, you have to make a change. That's an imperative that someone's giving you. But what about the opportunity to make some transitional changes, those incremental changes, even what I would call micro changes? Somebody said to me at work a few weeks ago that they had not drank a glass of water in like a year. They live on coffee and pop. They just don't like. So they said, do you think I should drink some water every day? And I said, yes. I said, yes. So they started out, they said, I think I can drink 1 glass of water a day. And I said, you know what? That's better than what you had before. Let that
right.
behavior take root. They said, I think I'm going to not take the elevator. I'm going to take the stairs from now on. That's a very small thing that they can do. It's a micro change. And those types of things can be very additive and have a very good health benefit. So I don't think we need to focus on being the star. Just get somewhere in the pack. When I go to watch a marathon every once in a while in Cleveland, we have these marathons. Sometimes I really like to see the people who come in last. They finish the race, and that's the best thing. It's not just the people who are out in front who are trying to get healthy. It's the ones who are just finishing. Get in the pack.
That's right. That's right. I read a book by a guy named Darren Hardy. He was the editor of Success Magazine, and he has a book called The Compound Effect, right? And that's just that you do one thing every day, and over time, that one thing, if you do nothing versus that one thing, your life is just going to just take off this way eventually, because as you do that one thing, you're going to improve more in that area of your life, which is going to be highly motivating, and it's going to cause you to do other things, and then other things, and then you're just going to just take off, right? So just like you said, just get your foot in the door, do one thing every day that's going to help you move toward your goal. You don't have to. It's not a sprint; it's a marathon, right?
Sure.
So,
and I don't think we can forget just about the physical health. We are multi-dimensional beings. We need to remember about taking care of ourselves psychologically, talking out our feelings, working on stress management, trying not to just engage in diversional stress activities like overeating or drinking too much or something like that, but turning around and actually facing the stressors head on. What is bothering us and deal with the stressor is much better than doing diversional stress management. And things like our spiritual health, a lot of nurses I know say, by the time I work my 12-hour shifts, I just don't feel like I want to go to my place of worship on my holy day. I just don't feel like there's anything left of me to do that. And then they get into a cycle where they start to feel guilty and bad about that. That's something that you might want to work on also. And our intellectual side, trying to learn something new every day. Just remember that there's lots of different dimensions to taking care of ourselves other than the physical dimension.
Absolutely, man. Absolutely. Before I got into nurse practitioner school, I was reading a book a week, and that was my thing, right? I would read a book a week. I don't know if you can see my.
I do.
I have book after book. This is one bookshelf I have, and I prided myself, and just trying to get it done. And someone asked me like, "How in the world do you read so much?" Well, for one, it's something that I really enjoy doing, and if you read. If you read 10 pages a day, which isn't very much, think about it, there's 365 days a year. So multiply 365 times 10 pages a day, that's 3,650 books, right?
Sure,
so
absolutely.
let's just say there's 250 pages in each book. That's a substantial amount of books, and, most people only read 2 books a year. One of them is nonfiction, right? So, if you can read 10 pages a day of something that's going to help you get better at whatever area of your life you want to get better in, man, that's just light years away from the people who are, just not reading at all,
Yeah.
So
absolutely.
just so many.
Somebody told me at the university, try to have at least a decent conversation every day with a really smart person. Seek out intelligent people, find a North Star, somebody who is you 5 years from now, where you want to be. And even if you're walking in their shadow, you're observing, and it's really great to just be around people who are where you want to be in the future, the best version of yourself, because they're just going to inspire you to want to do that. So I know when I was in school, I wasn't able to do a lot of reading, but I was around, other than textbooks, of course, but I was around so many smart people, and they really I picked up a lot of knowledge, and it was very uplifting.
Man, that's why I'm hanging out with you right now. That's
Okay.
exactly what I mean. So they say, you most resemble the 5 people who you spend the most time with.
Yeah.
So you want to really spend time with people who are, like you said, are going to cause you to, be inspired and motivated, and move to that next level. Look around, guys. If you have all your friends sit around the house playing video games, chances are you're probably going to be like that too, right? So, that's just one of those things. Who are you hanging out with? Man, that's great. Great advice.
Yeah, they said, show me your friends and I'll show you your future. I think that someone said that to me very parsimoniously. And you're right, if you're hanging out with people who are not well on any dimension and very unwell, or engaging in addictive behaviors, or not taking care of themselves, that's probably where you're going to start drifting. So it's really important to get with people. They say stick with the winners. That's very important. Right. Sure.
Well, listen, man, I really appreciate you again for taking the time. And I just want to affirm you, man. You're just an amazing guy. And I'm just so happy to have you as a friend, and just to be able to pick your brain and talk to you about some just great stuff. You motivate me, man. I'm inspired. And I just really appreciate you, David. Thank you.
Thank you very much. I'll talk to you soon.
Everybody else, I want to tell you about our so we have a fitness challenge. My idea was, I need to lose some weight. If I could lose, say, I don't know, 25 pounds, 30 pounds, that'd be awesome. So I thought, well, it'd really be cool if I had somebody, like an accountability partner, to help me out. We can help each other out. And so I kind of posted, on our group page, hey, anybody want to join me in some type of, fitness activity, something that we could do, to inspire each other to reach some goals. And then there was a ton of you guys and ladies that actually replied and are very interested in participating in some type of challenge. So I thought, well, heck, that's a good idea. Why not? Why don't we just do some kind of challenge, right? So I've been kind of toying around with the idea. I spoke with our president and a few other of our board members, and I thought that this would just be a great idea, right? And I feel like the name is the AAMN hashtag TEN4MEN health challenge. It's going to be a 10-week health challenge starting on January the 7th, and it's going to go through March the 12th. And so it'll be, we'll have before and after pics. And by the way, what I'll do is I'll submit or I'll create a Google Doc. And within that Google Doc, I will take the before and after pics and the measure weights, before and after weights, and we'll take measurements. We'll take a measurement of your neck, your bicep, your waist, and your thigh, and you will submit that, and I will have that uploaded in your own file within a Google Doc that only 3 judges that are going to be judging the contest will actually have access to. And what we will do, we will base the winner. There will be a grand prize winner, and there will be a runner-up winner. And we're going to base that decision based on body weight, a percentage lost within the 10 weeks, a BMI loss, and before and after pics. So we'll have those 3 criteria. We'll have 3 judges who are not participating to go ahead and give their, help judge the those that compete. Now we can still do all this without there to be a competition. So what I'm going to do is I'm going to say, if you want to compete for prizes, then we're going to make a $10 contribution toward the challenge, because we're going to have challenges within that 10 weeks for people to try to push through, right? And those that complete those individual challenges within the challenge will get, I don't know, maybe logo gear or that kind of stuff, right? So what we'll do is we'll take, so that just at $10 for those who want to compete and actually go for the grand prize, which I think is a great idea, because you're gonna be a little bit more motivated if you have some skin in the game, or you have, a prize that usually motivates people a little hard, a little more than not, right? But again, you don't have to donate $10. Just know if you don't donate the $10 or contribute the $10, then you're not going to be up for the grand prize or the challenge prizes within the middle of the challenge. Which those who complete the challenge within the challenge, anybody and everybody that completes those individual challenges will win a prize for that challenge, right? And it is an honor code situation, so we're going to trust that you're giving us the real information, whether or not you completed the challenge. These are going to be like squat challenges or maybe sit-up challenges or stuff like that within the challenge. So let's see, there'll be 3 judges. I'll have all the rest of the finer points. I will upload in maybe like just a document to our Facebook closed group page for everybody to take a look. So today is the 1st. The challenge will begin on the 7th. So you have until the 7th to decide if you want to do this. And if so, then we'll set up like maybe a PayPal, or that you can just send a PayPal $10 if you want to actually compete for the grand prize or the runner-up prize and the individual challenges. So that's it, guys. Thank you so much for your time. Thank you so much for your attention. Happy New Year. And I'm really excited about where the new year is going. We have some great things going on with AAMN, some really, really great things that are up and coming. And next week, our president, Blake Smith, is going to join me on the conference, and he's going to talk all about all the really good stuff that's coming up for our new year. And you guys are going to be excited to hear about it. I can't wait. Anyway, thanks again for showing up. Dr. David Foley, thank you so much for being on the show. And we will see you guys next week on the Nurse Station.